Welcome to the Hofstra North Shore LIJ School of Medicine ICE faculty development video. My name is Dr. Taranjita Ahuja, and I'm one of the directors of this program, also known as the Initial Clinical Experience. In this video, I'll be working alongside Drs. Alice Fernari and Bob Scanlon to role-play what a typical afternoon in your office should look like. We will take you through all the steps demonstrating from opening the day, introducing the patient to the student, having the student present to the preceptor, and finally, closing the day.
Hello, I'm Dr. Alice Fernari, the Director of Faculty Development for the North Shore LIJ Health System and Associate Dean of Educational Skills Development at the Hofstra North Shore LIJ School of Medicine. I'm here today to introduce the video that you're about to see that will help you to have a successful encounter with your medical student in your office practice. This will entail a 3-step process that will be outlined in the upcoming video. It will include preparation for your student, during the encounter with your student, and then a closure with your student before they leave the office. Now we will begin with the 3-step process. The first step is preparing the office for the student. It is very important that you tell your front desk staff that the student is arriving today. The next step would be for you to look at your patient encounter list and select patients that the students can see independently.
Hey, Belly.
Hi, Dr. Scanlon.
You got my schedule for this afternoon?
Yes, I do. Here it
Okay.
is.
Oh, great. We start at 1 o'clock. You know the medical student, Mallory, who worked with us about a month ago?
Yes.
She'll be coming again today, okay? So if you could just be looking out for her when she gets here, just knock on my door and I'll bring her in, okay?
Great,
Thanks.
Hi.
Hi, I'm Mallory, the medical student.
Oh, hi, Mallory. Hold on. Let me get Dr. Scanlon. I know he's waiting for you.
Great, thanks.
Come in.
Dr. Scanlon, I just wanted to let you know that the medical student, Mallory, she's here.
Oh, good. Have her come on in.
Sure. Hi, Mallory.
Thank you.
Hey, Mallory.
Hey, Dr. Scanlon.
Let's
how
have
are
a
you?
seat.
Great.
So no trouble getting here today, Mallory?
No, traffic wasn't bad.
Good, good. And class must have got out on time, right?
Yeah.
All right. I had Billy print out the schedule for the first hour, and I looked through it just to see where would be a good way for us to kind of divide up the patients,
Okay.
all right? The first patient's already in the room, and I've already spoken to her, so I'm gonna finish with her. The second patient is Mrs. Smith, and I've spoken with her already, and she knows I'm working with you today. She's coming in for what we call an acute visit. So I'd like you to go in and sort of find out, first off, why she came in today, get a little general history, and then come back here and meet me, and I'm gonna ask you to present her in a SNAPS format, okay?
Sounds great.
Very good. All right, so let's go see Mrs. Jones.
Okay.
Now we review step 2 to ensure that you have a successful encounter with your student during their office visit. You will review with the student the patients that they will see today independently. You will then begin to introduce your student to the patient, and they will do a history and physical. Upon completion of the history and physical, they will do an oral presentation using the SNAPS format.
Okay, Mallory, Mrs. Smith's in here. I had already spoken to her. She knows that I work with medical students, but let me introduce you, kind of give her the lay of the land, and then we'll get things started, okay?
Okay, great.
Hey, Mrs. Smith.
Oh, hi,
I'd like to introduce you to Mallory.
Oh,
Remember I told you I work with
Nice to meet
medical
you.
students?
Yes, nice
Mallory's
to meet you.
working with me today, all right, so she's on my team today.
Okay.
And I had told her that you came in with a problem today, and I'd like her, I know you've told the nurse,
Correct.
but I'd like her to dig into a little more detail.
Okay.
Sort of get a story, understand, do a focused exam,
Mhm.
get a sense for what's going on, and then she'll come out and present that to me. The two of us will come back in again.
All right.
Okay,
Sounds
so I'm
good.
gonna leave you and Mallory here, and I'll be back in a few minutes. You come to my office when you're all finished.
Absolutely.
Okay,
Thanks,
very
Dr.
good.
Scanlon.
Okay.
Hi, how are you today?
You're about to see a student do an oral presentation of the patient using the SNAPS format. This is a student-centered presentation style. The student will summarize the patient they've seen. They will narrow down their differential. They will analyze their thought process on the differential. They will probe the preceptor with a question. They will come up with a plan for the patient. And the most important, the final step, is they will come up with a self-directed learning question that they will research on their own.
Okay, Mallory. You had a chance to get your thoughts together?
Yeah.
Okay, so you talked with Mrs. Smith, did a little exam. Now what I'd like you to do is give me a nice presentation. Let's use the SNAPS format as our framework, okay? Perfect, go ahead.
Okay, great. So I just talked with Mrs. Smith. She's a 43-year-old woman. She's Grava 2, Para 2. Her last menstrual period was about 2 weeks ago. And her only significant past medical history is hypothyroidism. She currently takes Synthroid for that, but she's on no other medications. And she's had no surgeries, and she has no allergies. She's relatively healthy, but she came to the office today because for the last 3 days she's been having, she describes it as a crampy lower abdominal pain. And she said, so it started 3 days ago. It's better when she lies down, and she says it's worse after voiding. She described it as a crampy pain, and it relieves about 2 to 3 minutes after voiding. I asked her if it radiated anywhere, and she pointed below the belt. And she said there wasn't really anything that made it better or worse, except for just time. She rated it about an 8 during the pain, and about a baseline of 2. She said, I asked her about anything else, and she said she's had no nausea or vomiting, and she says this is the first time she's ever felt this pain. I also did a limited abdominal exam, and she was positive for lower quadrant tenderness and some guarding. So I thought a little bit about this, and my initial thoughts are, my top differential diagnosis is probably a UTI, as she says that the pain is worse with voiding. But I also want to rule out ovarian cyst and appendicitis, because those are things I wouldn't want to miss. So I was thinking ovarian cyst because of the location and quality of the pain, but it's not so high on my differential because she says this is the first time she's had this pain, and it's associated with voiding, so I'm not super worried about that. And appendicitis as well, there wasn't too much guarding over McBurney's point, and the pain wasn't very localized to either her umbilicus or McBurney's point. So that's generally what I'm thinking for now.
Okay.
Yeah.
What else do you think? Do you have things that now when you sort of sat down and put things together, you said, oh, I wish I asked that, or I have some piece of information I can't fill in? Do you see any gaps in do we know enough right now to say she's got a urinary tract infection and make a plan?
I don't think so. My next question is pretty much how do we diagnose a urinary tract infection?
Okay.
And can we do that here?
Okay.
Or is that something that we have to send out to a lab?
Okay,
Mm.
so that would be one thing. So we could do that, and I'll show you exactly what we
Okay.
do there. So that would be something to sort of bring in the urinary
Mhm.
tract infection. And you're saying then we would need to exclude the ovarian cyst
Right.
and the appendix. So anything you think we could do?
We'd probably do maybe a bimanual exam for ovarian cysts or
Okay.
an ultrasound.
Okay,
maybe,
perfect.
I would think.
Okay, and how
Yeah.
about for the appendix, to get that in or out of the store?
Appendix, I think, again, that would be with, maybe look at ultrasound. She would probably have a fever, because it's
Okay.
an infection,
Okay,
right?
good. So you're thinking more infectious along that way.
Right.
The other ones, we're thinking more of an anatomic thing.
Absolutely.
Okay, perfect. So now, let's go in and I'll show you what things we have here in the office that we can use, what office-based testing we have.
Okay.
And then we'll go sit down and talk with Mrs. Smith one more time. I just kind of want to go through the whole story with her again. with you.
Absolutely.
Okay?
Sounds great.
Perfect. All right,
Thanks.
so let's go see her together.
Great.
Now we're up to step 3 of the 3-step process to assure a successful visit with your student in your office. The third step is closure. We suggest you sit down with your student for a few minutes, review the patients they've seen independently, ask them if they have any questions, and then make sure they come up with a self-directed learning question that you will review with them next time they visit your office.
Okay, so we saw a bunch of patients today, right?
Yeah.
I think the one that we had or at least you had the best experience was Mrs. Smith. So, what do you think? What do you think she really has?
So I'm still sticking with the UTI theory, but I was kind of wondering, if we find out that she does have a UTI, how do we go on and now treat that?
Okay, so let me ask you a question. First off, how are we gonna really know she has a UTI? We have the suspicion.
Right.
I showed you the office-based test that we had that looks at a urinalysis.
Mhm.
But how are we gonna really know she has a urinary tract infection?
How are we going to really know? We're going to look at the urinalysis. No?
Okay, well, the urinalysis was positive, but what other test can I send off?
Oh, don't we send out a culture?
Perfect.
Okay.
Perfect, so the culture would come back, okay, so let's go down the road 3 or 4 days, because that's about when the culture would come
Right.
back, alrighty? What are we gonna do to treat her today? Because I can't tell her to stay uncomfortable for 3 more days.
Yeah. So I guess now it's more symptomatic relief. So maybe just some painkillers, or I heard people say that drinking cranberry juice is really good for
Okay.
UTIs.
Okay,
I don't really know actually.
yeah. Have you guys gone through the treatment specifically of urinary tract infections?
No, not yet.
So perfect. So now we've picked the self-directed learning thing. I mean, I could tell you, oh, I'm gonna give her this medicine, and it always works for my patients, and
Mhm.
you'll remember it till you get to the parking lot.
Right.
But if you have to go home and read about this and tell me what the line of treatments are for people with urinary tract infections, and you'll find there's some homeopathic remedies, there's prescription medications, and why we would use one versus another. Before, remember when we started looking at the schedule today to pick the day, before we jump into that, we're gonna talk about this. You'll give me a little 5-minute mini lesson on urinary tract infections. If you can give it to me and convince me, you're gonna remember it forever.
Okay, that sounds good to me.
Okay?
Yeah.
Anything else you think that we could go over? Anything else that would help our next experience? Because you're gonna be back here, if I remember
Mhm.
looking at the schedule, you'll be back here in 2 weeks. Do you think you had enough hands-on with the patients today?
I think today was good. Yeah.
Okay.
I think I'm starting to feel more comfortable with the hands-on, which is really good.
And are you comfortable with me leaving you in the room alone with the patient right in the beginning?
Yeah, absolutely.
Okay. All right, so the patients certainly feel comfortable with you doing it, so obviously you're making them feel comfortable. Okay, perfect. And then, and we work well as a team. That'll be how it works, okay?
Okay.
Very good.
Sounds
All right,
great.
so I'll see you in 2 weeks.
Yes.
All righty, make sure you text me the Sunday before, so I
Okay.
remember you're coming.
Absolutely.
Okay,
Thank
thanks.
you.
All right, good deal.
Bye.
I would like to personally thank you for your participation in the ICE program. Our team hopes that you find this video useful in preparing you, your staff, and your patients for having students in your office.